Good afternoon, everybody. We are in one of these simultaneous or parallel sessions of the last day of our 24th International Seminar on Service Learning. This is the service learning in terms of health. CLAYSS organizes the international seminar together with the service learning associations, OEI, and by other programs. We would like to greet and thank our panelists for their participation today, of the collaborators in their own working groups, as well as students who perform the different service learning projects and initiatives who will be presenting today. Today, with us, we have Lilian Medina and Barbara Suto from the CLAYSS team. I am Gerardo Bridi. I also belong to CLAYSS. The first part of this session will be the presentation of the initiatives of service learning developed by the 4 institutions that will be sharing with us today their work. We will be knowing in detail the projects by the Sao Paulo University, presented by Oswaldo Santos Baquero, from the Pablo Apóstol School, Yerba Buena in Tucumán. We have Evelina, Terán, and Enrique Terán from the University of Social Sciences in Singapore, presented by Hwai, and by the Pontificia Catholic University of Ecuador by Carlos Marcelo Moreano Barragán. Those would be the 4 presentations. Once the panel is over, we will invite you to the closing session that is from after this session at 4:15, he says. Each panel member should be introducing their projects. Towards the end, we will open the Q&A via chat. Any questions you have to deepen into presentations or to enable the specificity or specifications of panelists in any topic that may not have been presented regarding his or her project. We will then enable the Q&A via the chat we have in Zoom. The interpretation will be into English and Spanish. We will be finishing around 4 o'clock Argentine time. I'd like to invite Oswaldo for his presentation, and I will also comment on his professional background. Oswaldo, you can start. If you have a PowerPoint, would you like to share your screen? Oswaldo Santos Baquero is a veterinary doctor from the Columbia University, specialized in sciences. He's a doctor, PhD in epidemiology, and in the Sao Paulo University. Currently, he is also part of the Sao Paulo University research on peripheries and other matters. SUP is the Portuguese, Saúde Única em Periferias. Oswaldo Santos Baquero, he's a veterinary doctor, and he specialized in data science. He is PhD in epidemiology as well as in public health in Sao Paulo. Currently, he's professor of the veterinary school, Isotechnics, and of higher education in the Sao Paulo University. He's a researcher on peripheries. You can go ahead and take the floor. He is silenced.
Osvaldo está silenciado.
Listo. Perfecto. Discúlpenme. Ahora sí me están escuchando.
Yes, can you hear me now? Yes, we can. Very well and very clear, loud and clear. Thank you. Thank you for this introduction. Good afternoon for those of you who are joining us in this event. They're very interesting ideas and inspirational ideas to think about new roads, to create more transformation as well. I'd like to tap into this opportunity to greet and to thank the Sao Paulo University. I'm sorry, we lost his sound. As well as the research group, as well as in higher education. Sorry about that. Yes.
Perfecto.
Much better. Sorry, we lost his sound. I was greeting and thanking the institution who has supported this in this. His mic is too far away. I'm sorry. He must have touched something because we can't hear him properly. Just a second. No.
Vamos a ver aquí. Y así se escucha mejor. Ahora está mejor. Mejoró. Bien, entonces recapitulo.
So recapping, I was greeting you all and thanking all participants and the organizing team, as well as the institutional network from the very beginning has supported this project of the single health care in the peripheries. We can hear you. We hear you very low. I'm sorry, but there's a mic issue. Okay, let's see if for some reason my mic is maxed. I'd like to share with you some experiences that the SUP network, which is the peripheries single healthcare in a slum area. This was within the Sao Paulo University campus. But before this, before starting, not everybody really knows when we talk about single health, or as we say in Spanish, what does this mean? This refers to the social network in terms of health of people, animals, and the environment. SUP network, we work with this notion of public health, but this notion will be a little different from what you're used to, because it will refer to a collective of people, not necessarily human beings. No, there are other species as well, animal species and others. So that's why we consider these collective units are determined both socially and politically, and that's why there will be a deep impact on their health and health care. Can you hear me properly, he says?
Sí, Osvaldo.
Yes, we can hear you. So when we speak about the healthcare of the collective units, will mean several things. On the one hand, It represents, or it will refer to the experiences, to processes, to the conditions and the status of those collective units. Also, the healthcare has an epistemological connotation, that is to say, the understanding of those experiences. And on the other hand, there is another practical side to it, a transformative practice of those experiences. And so these three senses, when we speak about health and when we talk about the single health of the peripheries, may end up then influencing each other. So given this context of the public health of the peripheries is where we are acting on, and the experiences that I bring today are different because these collective units may be marginalized, peripheral collective units are, as you can imagine, everywhere. A favela, this slum area, is also everywhere. And the truth is that they were less than human in some cases. So let me talk to you a little bit about these experiences. And in doing so, I'd like to show you some images. This is the first one where you could actually think of a set of elements that are a problem from a health care point of view. On the one hand, you could see my mouse here. I am showing you with a cursor. Can you see that? It's like, it looks like garbage there. Yes, we could see it. So on the one hand, we see that there is accumulation of trash, of garbage. Then they have a cat that is loose, a person walking on a wet floor, which is polluted water, contaminated water. And I say that because if you see, look at the garbage, the trash on the floor, and this too, take a look at this, pay attention to this. There is a dead rat here, and that is also touching the water. And then we have the dog. It's the same water that the man in the previous picture was stepping on. Now, if we think about these, and in the last years in Brazil, thousands of people have died because of these situations, and other thousands of animals have also died from diseases. So we can quickly understand what this is about. This is a very serious problem, and it does take a toll in terms of lives. This is a situation that is not an isolated situation. I mean, this happened. There are many other transmissible diseases and non-transmissible diseases of other elements that are related to each other and that are determining the health of those who are part of the environment. And there's also a social and political connotation to these elements. And this is what we are noticing here, what we see. So it is given in a restricted geographical area. It's a favela, a slum area, very precarious, and with also limitations in terms of their structures that are unfavorable for health, for an appropriate health system. So when we speak about this health phenomena that are non-transmissible, we have also obesity, diabetes, and these other diseases that are associated to not an appropriate eating habits. So there are solutions for these, for leptospirosis, for instance. The WHO and other institutions have established a list of recommendations that are not that clear, but some of them do make a lot of sense when we think that these rodents, as we see here, that contaminate the environment, the microorganisms survive in these wet and damp environments. And when you're exposed to those contaminated areas, there is a possibility of transmission, of course. So this is said by the WHO, and we do agree with many of their provisions. You need to have a clean environment to avoid contact with such water. We're talking about contaminated or polluted water with the appropriate control, humanitarian control of rodents. And they do that very well, the WHO, at least according to that list. The problem arises when we want to transport this into our reality. And our realities, of course, is impacted by different phenomena. There are many problems that are concentrated precisely in those marginalized collective units, which takes place in the peripheries. And when you have that type of list into the peripheral area, we will confirm that an impossibility, great challenge to make progress in some of those recommendations by the WHO, because there are no appropriate conditions to make that possible. In other words, to actually, make the place adequate. So that's the problem we start facing at the time of when we try to omit those peripheral realities. And those are the challenges. The challenges are greater in those areas, especially to comply with those recommendations. When we speak about a residential area, is okay, but it's not applied to the periphery. Excuse me, Oswaldo. You have 5 minutes left for your presentation, so thank you. So given this situation, we started to think about how to approach it. And so we benefited then the networking, support network of dialogue. So through this network, to think about the place, the venue, what are the demands, what are the opportunities, and which are the limitations to be able to tap into the opportunities. And even when we set aside those recommendations, there are other situations, and we start working on dialogue, on enjoying where the team, the university team and students do not just restrict themselves to take information to such communities. Basically, the idea is to participate with them, learn with them, to invest time with them. So there is a trust relationship that is built. And from those relationships, that's when it is possible to have a dialogue on the territory, and possibilities then become viable. Possibilities for intervention become viable in these particular sites. So in that particular context is where we started to work in simultaneously with different, let's say, different units, with games, with dialogues, also with developing these types of moments that do help to try to respond to those problems through attitudes, through perceptions of children, of teenagers, of the community at large. And this is how we started to show an epidemiological profile of these collective, let's say, communities and possibilities of community actions to improve the health of these communities. So this is basically, this is an example. This is in Portuguese and it says health, human health, animal health, and environmental health. Saúde means health. So here you have different types of, there's a theater or participatory theater with friends and this artistic collective community. And you could see how they can project stories that refer to daily life, to what each one of the communities were living through. Their reflections on the daily activities. And it depends, of course, on some structural determinations, but there's also room for transformations, for changes in lifestyles within the community. And at the same time, they are good to motivate, to be able to work on deeper changes. And the idea is to support these communities with these structural issues being mitigated. So I quickly wanted to say that it's this type of approach that we're working on. And in order to give you an idea, a clearer idea, a clear-cut idea of the work we're doing, it is really worth going into the web page of our network. So here you have it on screen. It's easier for you to look at how this is integrated with other actions, how we work, building that collective discourse or speech, what happened with the pandemic, how the communities were able to manage that. And you can actually understand the pandemic from a different standpoint and think about preventive actions that could adjust to such reality. And you can also find all the theoretical work on that notion of health, how it is determined, and other applications that are reflected on that peripheral graphs and depictions. It's graphic, but it's also symbolic. So thank you very much. I'm closing then. Thank you so much, Oswaldo. And I remain available for any questions. Thank you.
Thank you very much. For those of you who have joined during these last minutes, at the end, we will open the chat for questions to the panelists. If you have any concern, if you doubt something that hasn't been explained about the project, that will be the time to ask them. To panel members, we would like to apologize, but considering the technical constraints, please adapt your presentations to only 15 minutes so that everybody has the same amount of time. And as if possible, during the last slide, try to show your contact information so that we can make up for this shortage of time. And in this way, people will be able to get in touch with you by email or chat or with your institutions. So in the last slide, try to show your contact information so the rest of the people can get in touch with you. At the end, we will have the chat open for participants to ask questions. Now I will introduce Enrique Terán and Evelina Terán. I will ask you to share the screen. I will read the background. Enrique Terán is a member of the Academic Council of the Center Juan Dalma, Fundación Miguel Lilio, Ministry of Education. He is an ad honorem coordinator of service learning from Paulo Acosta in Yerba Buena, Tucumán. He's a professional participant of CONICET until 2019. He's a member of the board of the Argentine Association of Behavioral Sciences as a delegate from Tucumán. As a teacher, he has received several awards as a result of his performance in scientific and technological activities, and as a result of his actions oriented to the preservation and conservation of regional biodiversity. Evelina is a veterinarian from the School of Agronomy and Zootechnia from the University of Tucumán. She's a professor of biology and professor of research project of the Pablo Acosta in Tucumán School, and she also coordinates healthcare projects. She participated as a co-author of several books and articles on different medical topics such as viruses, coronavirus, and biology of scorpions and poisonous animals, among others. She was recently invited to participate as a co-author in the digital book 2021 called Virus, Pandemics, and Us. So, you have the floor. Your microphone is off. Enrique, Evelina, you have the floor. Can you hear us? Yes, now we can. Thank you. So you have 15 minutes. So good afternoon. It is an honor for Pablo Apóstol School in Tucumán to participate of this 24th seminar. We would like to thank this opportunity where we will present aspects of integration of citizenship, science, and service learning related to health. Right now, well, my name is Evelina Terán. I am a professor of research projects from Pablo Apóstol, and Enrique Terán is responsible for the program Shared Knowledge and Social Commitment. Service learning in social sciences and natural sciences celebrates its 25th anniversary, and it's an experience that identifies the school according to the mission to teach schools in openness, service, availability, autonomy, critical thinking, creativity, under the motto, learning to live while studying and working. These images express the meaning of what these spaces imply. This is to chat, to understand. In this presentation, we focus on two aspects: the strength of the reference frameworks resulting during these participatory projects in the health area from two approaches: citizen science and service learning. And we would like to highlight the impact of young people as social indicators. Citizen science was developed by our students before it was called like that, and it was characterized by the leadership across scientific work, highlighting intellectual effort, use of tools and resources, and knowledge on the field. The use of a combination of traditional social communication techniques, and also contributions such as publications, boards, banners, trainings, and also trips to different provinces for different social sectors. But all this was supported by reference, acting as evaluators, and also it had the participation of universities and abroad literature. According to citizen science in the health area, this was consolidated on 4 contexts considered: knowledge, its implementation, evaluation, and all this within the framework of education, which enables to teach competencies and values. Service learning make this perception of reality, and this included 2 pillars that are very important for the learning of young people: cooperative learning and social cognition processes. Through our itinerary, we got this reference framework, these 2 pillars, health and disease, which followed the same path of the concept of health. Considering, for example, the animals of medical importance, different perspectives, economic and political perspectives, including psychological perspectives, and we achieved this concept developed by Oswaldo, which is the single health, which expresses interconnection between human health, veterinary medicine, health of wild animals, and issues related to ecosystems. So there was a double proposal. This was the starting point for our students. This was a social proposal, community health, joined to an ecological proposal, environmental health. With all this, we decided how this secondary education has an impact in their different projects of life, in their careers, in their studies. So we gathered witnesses and comments and leaders of the projects so as to have a general assessment of the impact on their education as well as social relevance in the integration of science and service learning. Here on these images, we can see Mariana. She's a student in the 6th year of medicine. She is studying to be a pediatrician. There's a Facundo, he's on his 5th year in medicine, and he's involved in the clinical record there. Maria de la Paz, she aims at helping others, disabled people, to gain autonomy. She's on her final stages of occupational health. So with all that, we gather all the comments from different students, medical students, and from similar careers. And in that case, we found this opportunity to discover the world and to work with problems that were ignored in the past. Especially, we got this from our network of former students. So we have different vocations, we have different virtues, and we offer the community everything that we have learned. We offer tools, we do our best, and we build our project especially taking into account solidarity values. For example, biology and biodiversity studies, participation in different topics of for medical animals, strengthened also in Guillermo and in Alejandro their vocation for natural sciences. We can see the images here, we can see field work on the laboratories. They are working on studying fish on the basins in the north of Argentina. Guillermo also has a PhD. He has made different contributions and publications, and Alejandro there is on his 5th year of biology. Guillermo is Alejandro's mentor, and right now Alejandro has a scholarship to go and work in the USA. Fabiana, she's a technical assistant in botanical anatomy. She's together with Lucrecia doing field work. And we will hear now the testimonies of these students. Sorry, but her sound is not audible. And there's personal and professional development. And here we can see experiences that give them empathy to understand the position of others. They gain flexibility to share with other social groups and audiences. So with engineers and biotechnology, we can observe Gabriela. She's an agronomist and she participates in different research projects. She has been participating since she was 6 years. Now she's doing a PhD. Then Lucrecia, she's a biotechnologist. She works especially on bacteria present in food and that cause different diseases. She's settled in Trieste, in Italy, and she has worked together with research centers in France and Slovenia. Marcos worked during high school in different projects with snakes of medical importance, and he participates in national and projects from abroad. And Pilar is an advanced student of industrial engineering. She's working on a metallurgic company, and she joined the projects when she was 11 years old. And with this, we can mention the following. This is what our students said. They were the most interesting years and most enriching. We learned how to work in teams, to work together with vulnerable communities. We worked with professors and researchers from different research centers and schools. I had the chance to share trips, to make friends, to get life experiences, to make cultural exchanges, to share knowledge, and to get to know numbers of people in different regions of the country. As a professional, I keep on implementing and I implement the tools that I've learned. Evelina and Enrique, you've just have 5 minutes left. Regarding the social relevance, we have this, and right now we can see what young people are doing. In the case of Diego, for example, he participates in different activities to restore ecosystems, in conservation of birds, and other students are participants as positive leaders, such as, for example, the group of Apostles of Lourdes. In the case of Lourdes, at school, she participated in a project called Human Life Development, and she was working in this new project, Nuevo Amanecer. Jose, you can also see him in the picture. He presented conservation projects, nature conservation projects, and he's all in his 3rd year of civil engineering. Maria de la Paz works with young people, disabled people with different ages, and what we can say is that there is this proposal and that really triggered her vocation. And as a conclusion, regardless of having worked in health and environment, you can observe the wide range of careers of all the students. So we have to mention that there is this ludic motivation. Then we can see creativity, development of skills to interpret images, acquire language skills, the creation of bonds, respect for others, and the development of competencies in social cognition, and the implementation in new situations of what was learned during the learning process. And so we find a conception of culture as an encounter between generations, as a style of work that gathers young people and puts them together, like Alfonso López Quintana said. They express values that become virtues. So thank you very much. Thank you much, Evelina. Thank you, Enrique, for your comments, for respecting the time. Now I will invite Hwai to share her screen. She will talk about the project of the University of Social Sciences from Singapore. She's the president of the Alumni Committee from Gerontology of the University of Social Sciences from Singapore. She is as director of the Alliance of Integrated Systems, and she does collaborations on digital innovation in the public health sector in Singapore. She has a great combination between engineering, business, and gerontology. He has over 15 years of experience in the technological industry. She has knowledge in sales, business development, corporate strategies, and innovation in emerging countries in Asia. She's passionate for making positive contributions to society, and she's a leader in citizenship programs, and she assesses organizations to become part of the city of community in Singapore. Hwai, you have the floor.
Thank you very much. Good afternoon, everyone. Thank you, the organizer, for having me today. So my name is Hwai. I'm from Singapore. So let me share with you the experience of having service learning through leading the alumni movement. So first, I must start with this, where I need to let everyone know that in Singapore, we are also facing an aging population, where our population is actually aging very quickly, as most of our fertility rate is also dropping. So therefore, you could see that actually by year 2030, in terms of percentage, we have more elderly in terms of percentage than Japan. So therefore, it is very important for the country to train more people who are professionals who can take care of the old people. So gerontology studies is studies about how we can bring positive impact to the life of the older person. And these studies actually covers many dimensions. It covers the health part, which could be the bio, psycho, social, the spiritual portion, the government policies, families, ties, communities, and so forth. And this program is very much Asian focused, and hence we are always looking at what are the Asian values that need to be imparted to the people that we train, so that they know how to take care of their parents and the elderly in their community through Asian values. And of course, this is an applied approach where we constantly bring our students and our alumni to the field to actually learn on the ground what exactly it is to serve the community and to understand and be empathized of the older people. Hence, this is very much very suitable for mature and lifelong learners. So I want to tell you about our alumni committee. So basically, we have about 300 students to date. This program has run for almost 11 years now. So with the students and alumni, we are trying to promote the importance of having gerontology studies in Singapore. As I mentioned, because our population is aging and we need people who are trained and know how to take care of the community as they old. And also we would like to make gerontology a professional so that people can recognize these students or alumni who are trained in this profession and to be able to contribute positively to the community and also to the government policies. And hence, we are always looking for how possible ways that we can exchange our knowledge, our research output with the academia, with the industry players, policymakers, and the people sectors, which are the community services. So how do we do that? So by forming a committee, we actually wanted to bring everyone together so that at least we could build an ecosystem within Singapore that connects not just the educational institutions who are teaching also about healthcare, about older people, that also covers people sector, which are the social service provider, the healthcare institutions, and the community services. So by bringing them working together closely with the universities, we actually open up opportunities for our students and alumni to actually intern or make a contribution by working there upon their graduation. And we also do organize activities through the alumni committee so that the students get to participate early enough to know how to contribute to the community. And there's also another side which I mentioned about policymakers and economic drivers, such as the government sector and private companies who are actually also looking to penetrate the silver industry and hoping to sell their solutions or products to the older generation. And this is where our students and alumni can also contribute in their know-how and also the knowledge. So ultimately, the aim of the Alumni Committee is actually to build a holistic ecosystem. And how do we do that is through this 3E framework. So first E is called exchange. So it's very important for us to have thought leadership, to be able to have dialogues with the industry and academia, to tell them what is important when taking care of old people. And you do not just look into, like I mentioned, the health part, but also the social part, the communities, and also their families. And we also will have these exchanges with overseas universities, like this opportunity that I have with you today, to share about what we do and how we actually allow service learning to happen through our activities. And also we will be the voices of senior issues through media, where we actually publish articles and publications so that to raise the public awareness about aging population and how they can be better aware of what's happening with their parents and also for people around them who are also aging. Another part is called experiential, where we actually bring our students and alumni to interact directly with the seniors, to understand how they feel, to have certain activities with them so that they understood how to interact with empathy. And learning trips also with the senior service operators, whereby we actually bring our students to some of the senior homes so that they understand how these senior homes are being operated and what are the key concerns and challenges, and so that they can also help them to brainstorm what are the best opportunities to address. And definitely there are also job opportunities for these students to take on as they graduate from the course. And the third part is what we call engage, and this is where we actually establish collaboration projects with industry partners, looking at certain specific topic about seniors related issues or maybe opportunities that private companies would like to tap on, and we will actually have our students or even our alumni to tag along with some of these industry partners and work on certain projects. I will show some of these examples in my next few slides. So as I mentioned in the exchange, so we often have a lot of dialogues with our ministers where we actually do bring in our government officials to our classes so that we can have a meaningful discussion about the current policies and whether it's helping seniors, elderly, or even the retirement policies, whether people are able to retire comfortably. We also have dialogues about health, whether how subsidies can be applied so that we can have more universal coverage. There are also events that we organize by the students that are alumni through exhibition and also through various seminars where we try to raise more awareness. So these are programs that are organized by students and alumni, not by the school. So this actually allows the students to have the exposure on knowing how to get gain context in this industry and also to be able to engage in meaningful dialogues with these people of influence. And also during the COVID-19 in year 2020, we host a lot of virtual platforms to have more exchanges so that we can continue to push through the importance of taking care of the aging population and also what are the key issues that we need to address. And also during this period, there are many senior entrepreneurs. They are also looking at how they can actually pivot from retirement to become an entrepreneur. And that is where our students and alumni also came in and worked together with the seniors and came up with some business ideas and moving them towards a senior entrepreneurship. So I think this is another way where we actually apply the knowledge we learn in class, and basically we're trying to help the elderly who are actually interested to become an entrepreneur themselves. And our own alumni also become their business partner to launch businesses in this civil industry. And definitely in terms of career, and that is also, we have a lot of dialogues with hirer in the social sector who are looking at people who are trained on looking at aging issues and also who knows how to take care of the elderly, so that we can actually have them placed in jobs. They are not only in senior care, but also in healthcare and also in policies, and many time is also in the private sector, where the human resource department, even in law firm where they are doing will for the elderly, they do now start to hire people who are trained in gerontology. In terms of engage, this is where we do joint projects with industry partners or joint collaboration with overseas organizations. So these photos on the left is actually a joint collaboration we have with the Ministry of Health and also some agencies in Singapore, where we visited Taiwan to learn the Taiwan way of taking care of the elderly and their senior sector business. And we also have another project in the middle here, where we are actually working with an hospital in Singapore to use virtual reality to help dementia patient to actually remember what had happened in their younger days, so that they can actually have a more joyful aging despite the dementia condition. So basically, it's a research project where we actually bring our students together with the hospitals and try to experiment with various virtual reality concept, so that we want to see whether if this will actually help the dementia patient age well. As we all know, dementia is not able to cure, but at least with this, we can slow down the disease progression. And also, we work a lot
De la misma manera, trabajamos
support agency, looking at how to make the elderly age actively and to have an environment that allow them to exercise in a very safe manner, as well as to create an intergenerational design. So this is actually a 6 months project where we have our students and alumni attached with the Singapore Sport Agency, looking at their architecture, looking at their well-being programs, and design certain programs that will be helpful for the general public. In terms of experiential, this is where we actually bring our students and alumni to interact directly with the seniors, so that they understand what's their thinking, and then also be able to interact with them comfortably in the community. So for example, the picture on the left, we brought in a group of seniors, about 40 of them, to the campus. And then we actually have a one-day sharing about what we learned in class. And then we also like to understand whether do they feel what we are studying is useful to be able to understand them better. And we also do conduct certain technology transfer to the seniors, where we actually bring some seniors and then we teach them some tech knowledge, and then we also do some online interviews so that they are more exposed to how to use an online Facebook live stream. So this is something that we also try to teach the seniors about digital, and also to close the digital divide. And of course, there are celebrations such as Christmas, where we actually bring our students and alumni to the hospitals, and they actually do interact directly with the patients, sing songs, and maybe accompany them, befriending. And that is also another way for them to learn how to interact with the seniors and also people that are of a certain different sickness. Also, we often will bring our students.
Te interrumpo un minutito, te quedan 5 minutos.
5 minutes left. Why?
Okay, sure. So I just wanted to share with everyone that actually there are a lot of this experiential, where we try to make people interact with one another, including even coming on Zoom to sing a song. And this also to bring their families together, so as there's an intergenerational experience through online. And we do also have, for example, this Chinese New Year celebration this year. Again, because of COVID-19, we are not able to gather. So what we do was we actually bring this virtual experience to the nursing home, to the community, where the elderly are gathered at a community center. They view the show through their mobile devices or even through live stream on big screen. So in conclusion, what we are trying to do here is basically we have a group of students who are trained in handling the aging issues and also to understand the elderly. And through the Alumni Committee, we are trying to give them opportunities to be able to apply the knowledge from classroom to the community. And the way that we actually apply this knowledge is through, as I mentioned, the 3E framework. First is to exchange their point of view, all right, to have a lot of dialogues with the key stakeholders, experiential, so that they are able to know how to serve the community, how to serve the senior population, including their caregivers, and of course, engage in some meaningful projects directly with the industry player so that they can make product and services that are available to the market. So this is my email address. In case you need to reach out to me, feel free to drop me an email. Thank you.
Muchas gracias, Hwai.
Thank you very much.
Thank you very much. You've been great at summarizing. You were able to share the most important aspects of the projects you are developing in a very illustrative way. Now I will invite Carlos Marcelo Moreano Barragán to prepare his screen. As we were saying, at the end we will open the chat for questions from the audience. Please think about your questions so that we can do it in a more dynamic way. Marcelo, you can share your screen. Carlos Marcelo Moreano Barragán, he has a PhD in medicine and surgery. He's a teacher of the Pontificia Catholic University of Ecuador. He's the coordinator of the connection and endogenous development from Sixus and Chuchilan. He's a member of the research team on service learning. He will also give the floor to Ian Nicolai Lerena and Pedro Patango Pamangate for the students involved to participate. So, Carlos Marcelo, the floor is yours. We cannot hear you, Marcelo. Perhaps your microphone is off. Sorry. Yeah, I'm a bit nervous, I think. You can share your screen. Can you see it right now? Yes, we can see it. We can see it perfectly well. Great. So it is an honor to participate. I'm very glad that CLAYSS and the organizers have chosen this project. We were discussing this in a research group, and this is part of the linkage processes from the university. Ian Gerena, as you were saying, Ian is no longer a university student because he graduated like a couple of months ago. And Pedro doesn't belong to the university, he belongs to the communities. I had asked Pedro via chat to turn on his camera during the presentation. This project was developed in this territory. Perhaps we cannot appreciate it very well, but Quito city is 2.5 hours and a half from the city, and these are peripheral neighborhoods. And here you can see a very well-known volcano, Cotopaxi, and there's another one over there called Ilinisas. And the territory includes Canton from the province of Cotopaxi, which is a very interesting and attractive area from the landscape point of view, and of course from the people's point of view. So this project is called Development, Endogenous Development of the Site in Tenochtitlan, and it is aimed at considering this development theories. It is aimed at getting support to these populations in the search for improving their well-being. Marcelo, maybe your images would be more appreciated if you use the full screen mode. It is in full screen mode. Or perhaps at the bottom, slideshow or something like that. Maybe the pictures are very small. This is one of the touristic attractions in the area. It is called Viquicotoa Lagoon. This is a group of students over there who participated some months ago. And our work, as I was saying, and made the project like an interdisciplinary project. There are 14 schools from the university participating in the project. This is a community in the subtropical area. Here the economic activity is a bit complex because they have like a single crop with the kind of grapes, or actually, no, not grapes, but blueberries or berries, blackberries. And the community, part of the population in this area has an indigenous origin. So there's interculturality there, which is very important in health matters. And Pedro, here with us today, he belongs to that area, and he's been a translator for many of the children who participated. So what I would like to explain is first the context of the health and nutrition policies, because the university, and this is the competency of university, are very related to professionals who will have to exercise their profession in these realities, which are not very common for children, because children usually come from, so I mean, students come from different cities in the country. The project will be briefly described, and then we will analyze some of the interventions, some of our interventions. Ian Gerena participated in some of this and in an early research from the health group. So the approach is service learning, and in the university, this was being an important work by the group. In this comprehensive health model is a model that stratifies services going from primary care to special care. Our approach, of course, will focus on primary care in this district. Well, actually, it's not a district because it was restructured, but there is a base hospital in situ in the principal city, and there are some 6 primary care units, which are these centers, these health centers. And in this system, we can guarantee care for the population. In these last 2-3 months with the new administration, vaccination is focused on schools, and yesterday it will be focused on 1,800 health units that we'll explain later on. So this primary care has several roles. It is like the entrance door to the service. It includes promotion. There's individual responsibility. Healthcare problems must be integrated in a comprehensive manner. And in this first primary care, there are healthcare posts, medical practices and dispensaries or mobile units. And this is the context in which our students work. And what we believe the essential role is, from an academic standpoint, is that students practice according to their skills. The university has these three different working pillars: research, teaching or training of professions, and the creation of links. This is an area that has been promoted in these last years, and it's been an opportunity for the project. So what we like to stress, and there's a link here to the research, is this perspective from St. Ignatius of Loyola, where we work in a context, we review experience, action, and assessment of that action within the context. Service learning has a similar structure, where students get in touch with the process from the healthcare point of view. In this presentation, we've got students from the School of Architecture, of Biochemistry, Linguistics, Communications, and this has made this perspective very enriching. And this connection, or this bonding, helps or make students really contribute. So we hope we contribute to professionals too, who are also working here, even though professionals are more in touch with professors who work on primary care. Marcelo, please take 5 minutes. We just have 5 minutes left. So the project focuses on identity, entrepreneurs, and habitat. And these are the main objectives, or specific objectives. And we are working with this sub-center. And the methodology includes enrolling students who know the place and who consider that they have these skills to develop a specific projects. Projects are connected to these topics in the university, and Ian was going to tell you a bit about his work. I'm not sure, Ian, if you're here with us. So good afternoon, I'm Ian Evelina. I'm a former student of the Pontificia Catholic University. I'm a surgeon, and I was part of this development project. I would like to share very briefly the process we carried out. We carried out research on nutritional habits to determine the nutritional situation in which we could intervene in different educational units. This process was carried out by the implementation of family records. And in these family records, we gathered all the information based on a 24-hour schedule. We asked them what they had eaten the day before, and we were able to determine the type of nutrition the community had. We also asked whether the origin of this food was within or outside the community, and whether the family had the possibility of producing food to satisfy their needs. However, during the research, we were able to determine that all the production, or most of the production, were used for trading, not to satisfying their own needs. We also created health files, we gathered information, we launched hand washing campaigns, even though it can be considered a routine, but in these types of communities where the lack of water or resources is evident, this becomes very complicated. We also did an update course on maternal and child health on primary care, and we also designed a calendar which helped us reinforce nutrition and health of the families in order to determine the impact of this calendar in the nutrition of the family. Thank you, Ian. So like Ian mentioned, these were the different activities carried out through the School of Medicine. We worked with orchards and in nutritional medicine, and these are some of the images related to the campaign, the hand-washing campaign, which was really reinforced during the pandemic. This is one of the images of the work done with schools and the creation of these family files or family records. Pedro, perhaps very briefly, you can tell us what you've been doing. First of all, dear all, thank you very much. I'm Pedro Patango. I am a technician in primary healthcare. I work in a healthcare center in Chuquilan, which belongs to the province of Cotopaxi. And in relation to this presentation, the trainings that we offer to the primary care technicians were very important for students also. This helped us a lot to have a broader knowledge and then to share them with community leaders and families. We also had the chance to learn the use of the calendar. That was very important, and it showed that together with the POSE teams and with healthcare professionals, we went to the communities. This was very important for mothers and community leaders, because sometimes in these communities, many mothers and fathers are illiterate. So if we only speak, they don't understand. And while with this calendar that they have on their door, they can observe and how to and find recommendations on what to eat. And this is very important for them. And as a conclusion, we can say that POSE teams, both students, have to keep on working in our communities, because that helps us a lot. We will then share with community leaders and with social actors and other authorities in order to have different trainings and to learn on healthcare issues. We are like an entrance doors to these communities, and we are the entrance door for the work done in the universities. Since we speak these two languages, we have greater access to the families and to the people in our communities. Thank you very much. Thank you. And while we ask Marcelo to just take one more minute to conclude, and as from now, we will open up the chat to ask questions to panel members, which will be read for them to answer. Just one more comment. Thank you. What we can see is that in this type of territory, for 4 years in which we carried out the project, the reality is very complex, very difficult. It is very difficult. This is what we appreciate in our initial assessment. But what we could see is that students, thanks to their knowledge, get to know this reality and make contributions in terms of development. What also happens is that some students get more involved than others, but we believe that from the medical practice point of view, it is possible to choose public health practices, and they can gain experience. And finally, I cannot perceive a change in the situation right now. We have to understand this complexity of human relations, and we are aiming at strengthening teams who promote these entrepreneurships based on their reality. So Enrique and Evelina's project really was very interesting for me, because there's a perception of deterioration of the environment by the population, but people are really willing to change their realities. These are the families, and this is the contact information. Thank you, Marcelo. Thank you, Pedro and Ian, for your participation. We are receiving some questions on the chat. I will ask my colleague from CLAYSS, who lives in the north of our country, to please read these questions.
Sí, buenas tardes a todos.
So, good afternoon. There's a question for Marcelo. Can you hear me? Yes. So, apart from congratulating you, apart from all the congratulations for all the speakers and for all the panelists, there is a question for Marcelo. What learnings are acquired in by university students? What can university students learn from the community? So please try to make short answers.
Yes, I see that a space like this, the one we have here, it may be hard for students, like a collision. Why? Because they think that this intercultural reality that they experience in the population is as impacting, because this area I mentioned is very, very poor. And I think that's one of the most important aspects from the community towards these children. These children question themselves. I mean, they question their own competencies and skills. Thank you, Marcelo. Lilian? So you probably can see that everybody is commending you and thanking you for what you have, your enriching experiences and the experiences with your students. All the chat is focused on congratulating you for your experiences, for experiences shared. You've shown us how health could be worked at from different venues, let's say. So they're actually underscoring motivation, learning, service learning, the excellence of tasks, the impact of design and technology.
Hay una
And she's reading questions. There's a question for you, Hwai. The impact of design and technology in improving the quality of life in the elderly. Was there a change in their lifestyles, in the elderly's lifestyle in Singapore? And we can add to that, what is the profile of the student who wants to work in gerontology?
All right,
Okay,
thank you
you can
very much for
answer.
the question. Yes, so basically, with the technology, basically, when it first started, the elderly was not receptive of this use of even a smartphone, because most of them are not trained how to even know how to operate one. But during the last 2 years, since COVID has happened, we actually have our students, alumni, to go down to the community and teach the elderly how to use a smartphone, how do you connect to the internet, and how to use a WhatsApp. So basically, with this experience, they are now more receptive, and actually, in terms of their lifestyle, they are actually more connected compared to when during the lockdown period, they're actually not able to meet their friends. So with the digital divide, they actually can use their smartphone to connect with others. Regarding the profile of our gerontology students, they range from age about 20 years old, who are probably just graduated from their undergraduate, but they are actually having the heart to serve in a community to work with the elderly, to as old as 70 years old, people who are already retired but still wanting to learn. So actually, these are mostly, like I say, adult learners. So they come during weekend to actually take a Saturday class full day to learn about various topics on aging and about elderly. And their industry can be very wide as well. There are healthcare people, there are also engineers, there are also lawyers, financial advisor, and government employees. Yeah, so even teachers are also attending gerontology because they are wanting to impart this knowledge to the younger generation on how do they address the aging issue. I hope I have answered to the question.
Bien.
Muy bien.
Yes. One doubt, Gerardo, please. What is the role of those students that actually, finish school, of the graduates? What's their role of the graduates in the project?
Okay, so in our project, which is the Alumni Committee, right? So the role of the students who have graduated, they are actually the one who organize the activities. They are the one that put together the committee and identify what are the needs in the society. And they actually put out certain programs. So if you talk about the Alumni Committee, our students who have graduated are the one that establish the contact with the industry partners, organize the activity, get the current students and also other alumni to join them and run those engagement, exchange and all. Yeah. So those are the roles that they play. And they themselves have a full-time job. So some of them, like I said, they are from healthcare, so they probably are nurses and doctors. So they may see the needs come from their own institution. So they will bring this opportunity to the students to say, hey, I need someone to come and help me out in the dementia patient ward. So that is where we actually introduce our students and alumni to go for a 1 day or even a project, yeah, so that we can actually refer them to the actual community and serve their knowledge. I hope I answered to the question.
Sí,
Yes, you have. Thank you so much, Hwai. I'm sure we would love to continue sharing this moment, but it's already time for closing. And so I'd like to thank you so much for your presence here, for joining in, for those of you who participated as panel members and the audience, to your teams, your students, not only for your projects, but for the preparation for to be able to share your projects and these experiences which are so enriching with us all. And also the work of Barbara and Lilian from CLAYSS. We've been working on this panel for some time now as well. We invite you, as usual, to register to CLAYSS networks to get a hold of, to be abreast of all the updates in our organization, and in upcoming moments, maybe in 7 or 8 minutes, we will participate in the closing plenary session via YouTube. I said in a few 7 or 8 minutes time. So our academic director, Nieves Tapia, the president of the Uruguay volunteer, Lucina Way, and CLAYSS team will be closing these few sessions we've shared with a wealth of experiences that really enthuse us so much. And of course, God willing, and in contact via the networks or social media, we hope to see you in our next seminar next year. And I hope we have new experiences and new learning experiences. Thank you all. And I'll be seeing you in the closing plenary session in a few minutes' time. Thank you very much. Thank you. Thank you. Thank you all. Thank you so much. Thank you. Thank you.